Oregon lawmakers earlier this year passed a bill that would tax hospitals to help cover Medicaid costs for hundreds of thousands of Oregonians. The tax would raise a huge amount of money, but it didn't sit well with Republican State Representative Julie Parrish. She joins us tonight to discuss her efforts to have Oregon voters ultimately decide the fate of the tax. Also tonight, Multnomah County Commissioner Loretta Smith. Rumors have been swirling about Smith's political future, even as she responds to several investigations into allegations of misconduct. Smith joins us to discuss that and the latest on her summer jobs program. From KGW News, this is Straight Talk with Laurel Porter.
Good evening. Thank you for joining us tonight for Straight Talk. I'm Laurel Porter. There is a political fight brewing over how to pay for Oregon's Medicaid expansion. And if some Republican lawmakers have their way, you may get the final say during a special election in January. State Representative Julie Parrish says their goal is to prevent insurers from passing the cost of the tax onto consumers. The governor says the effort would jeopardize health coverage to hundreds of thousands of Oregonians. We'll hear from Representative Parrish in just a moment. And later, Multnomah County Commissioner Loretta Smith will join me to talk about her future political plans. And she'll address an investigation into allegations made against her by two former staffers. First, welcome to my guest, Oregon Republican State Representative from District 37, Julie Parrish. Thank you for joining us here on Straight Talk. Your first time here. It's great to have you here.
Thanks for having me. I appreciate it.
First, help us understand what this hospital provider tax is that the legislature passed and why you're so passionate about overturning parts of it.
So House Bill 2391 was billed as the Medicaid bill. It was the funding mechanism to help fund Medicaid. And we are not repealing the entire bill. There were actually some shared agreed upon premises between Republicans and Democrats in the bill. And so we've left those alone. What the referendum really is, and it's, first of all, it's about giving voters a chance to vote on what is otherwise a sales tax on their health care. I mean, if we hear all the time in the legislature, health care is a human right, and we believe that if it is, then we shouldn't be taxing it. That's not the way to make it more affordable. And so there are just four small sections of the bill that essentially repeal back $330 million of the entire package, not the entire package, and a provision of the bill which would allow insurance companies to pass this tax directly onto consumers. And we hear a lot of times in some of these tax fights, well, corporations will just pass that on. This bill actually gave express permission for insurance corporations to pass the tax on. And so we find that objectionable, and we think voters should have a chance to vote.
The governor has said that the Medicaid funding package was the result of broad and bipartisan agreement after months of work, and it has broad support from the healthcare industry. You're asking for the governor to call for a special session. Do you think that's going to happen?
Well, I don't think it's going to happen. I think she said as much. And, unfortunately, the governor is also running for office right now, and the Medicaid providers who support this tax, the for-profit Medicaid providers who support this tax, just gave the governor $60,000 for her reelection. So, and she came into the session saying passing these taxes was her #1 priority. We actually are not opposed to the idea of some kind of taxation to pay for Medicaid. And in fact, an alternative bill for Medicaid had a tobacco tax in it. We think that that's a more appropriate place to go and look for dollars for health care, is something that actually creates a healthcare cost, i.e. smoking. So I don't sort of buy what the governor's selling right there.
Well, let's talk about the referendum, because your critics say that you don't really have a clear replacement plan for this that would leave hundreds of thousands of Oregonians in the Oregon Health Plan who are covered under that expanded Medicaid in the lurch without anything. What is your plan for replacing it? Is the tobacco tax enough?
Well, I think that we have to first look at the fact that, this week the governor's office was supposed to release data on how many people were ineligible for Medicaid. You might have read that story in the Oregonian. Thousands of people declared ineligible. Well, they're up to right now, last time I checked, 56,000 people who were either income or residency ineligible for Medicaid. That's $577 million of state and local revenue we don't believe we needed to raise to begin with. So we think, and starting going right off that House Bill 2391 was based on bad data from the Oregon Health Authority, and then we use those numbers to generate what we think we needed for a tax. We dispute that, and that's really what's at the center of this debate. The other interesting piece that's going to drive Medicaid eligibility downward is the state just raised the minimum wage. So in the metro area, if you were on Medicaid and you're a family of two and you now make $11.25 an hour, if you're working 40 hours, you're not qualified for Medicaid anymore. So that's another policy decision that sort of overlays on what is really the true need to fund Medicaid. You know, understand, Laurel, I grew up in the Medicaid system. We were poor growing up. I can remember when, you know, you got mailed a piece of paper every month from the, you know, state welfare office, and that's what you got to use to take to the doctor. I voted for the coordinated care organizations when we passed that law in 2011, and the very first bill I ever had signed into law by Governor Kitzhaber was a Medicaid expansion bill. So I'm not opposed to Medicaid. I am opposed to a taxation mechanism that is in the bill that we don't think is stable. We think that one of the taxes in the bill, which is a tax on the Medicaid providers themselves. So we're going to go tax Medicaid dollars and then use it to try to create another phony matchup to the federal government. We actually don't think that's going to pass muster with the federal government. We think this bill has problems.
But if eliminating the people who are ineligible, is that going to be enough of a plan to fill the gap? Some may think that you just want to defund the Medicaid program. Is that your goal?
Well, remember, I said at the beginning of this segment, there are shared upon premises in the bill that we left that generate a lot of money. And so there's two pieces of this. One is there's a hospital assessment, and we've currently been using this. And so it's sort of a money laundering scheme. That's the best way I know how to describe it. We go to the hospitals and the long-term care facilities in our state, and we say, hey, give us, you know, $100, and we'll take that and match it up with the Medicaid dollars from the federal government, and then we'll give it back to you. And our legislative legal does not believe that that is an actual tax. And so that got left in the bill. That generates a lot of money to cover Medicaid. The other thing is that the state testified that we had a year's worth of reserve for Medicaid on the books. So no one's losing their health care if we come back to the drawing board on $330 million of taxes to even determine if we need that much to begin with.
You use the number $330 million in taxes, but your opponents would say that leaves out the other component, the $330 million of federal matching funds. So what you're really talking about is $660 million, which is a big gaping hole because the legislature used that provider tax to help fill that budget gap of $1.8 billion. If voters don't approve these taxes, isn't that going to leave a big budget mess when lawmakers go back in February?
So again, we go back to the 56,000 people. We start there. That was $577 million of money we didn't need to raise of state and local dollars. So that's your state dollars and your match dollars, because these are folks who are not on our system anymore. Some of them even just moved the state, and we kept making hundreds of millions of dollars of overpayments to Medicaid providers, and they just got to keep that money. I mean, it is really Medicaid profiteering as far as I'm concerned. And so we need to go back. We have a year's worth of funding on the books. We have a shared upon agreement and premise of the bill that raises a lot of money. And then there's this last little piece. Voters gave us an annual session for a reason, so that we could use the best possible data from which to budget. We knew that this redetermination work was going to happen, and we were supposed to have a deadline of information by August 31st. There was no need to actually pass taxes that we may or may not need. And in fact, you know, talking to one of the governor's staffers, they're like, well, maybe we just find a way to give it back to voters. How about we just don't take it from voters to begin with? A tax on health care, as Oregonians are getting double-digit rate increases. If you have Kaiser, it's a 14% rate increase before the tax. If you have Providence, it's a 10% rate increase next year before the tax. If you have Regions, they're not even going to serve half the counties in Oregon anymore because this package is so screwed up and it is costing money. And so we're seeing, you know, the hospitals, because there is a hard tax on hospitals that is not that funny money assessment, a real tax on their net revenues. We've seen the St. Charles Hospital say, we're not going to, you know, we're going into hiring freeze. We've seen Providence say they're going to do layoffs. We've seen the Corvallis Hospital system say hiring freeze, we're not breaking ground on new facilities. I mean, we're breaking healthcare in this state, and we have to do something different. And I'm hoping voters will get educated and look at this issue for what it is. It is a sales tax on healthcare, period.
Critics also say that you're not only a representative, but you're a big-time political operative, that you worked on Dennis Richardson, the Secretary of State's campaign, that you could personally profit from a ballot referendum, whether or not it's successful. Are you getting paid for working on the referendum campaign?
No, and I've said it a million times. Yes, I did support Dennis Richardson's election and worked for him in terms of big time profit. Laurel, someday I'll be happy to walk your viewers through how to use the Secretary of State's campaign finance website to see what that actually looks like. So I would say a nominal monthly stipend to put in 90 hours a week to run that race and help get him elected. It was sort of not big time political consultant.
Are you getting any money at all, indirectly or directly, from doing this referendum?
No, I have been reimbursed for hard costs for things like the mail, running out to the post office and putting petitions in the mail. But no, my company has in-kinded all of our time and work for this. I just believe that voters deserve to have a right to vote. And interestingly, I have TRICARE, the military health insurance. I'm not impacted by these taxes at all. I just think that they are so horribly wrong that voters should have a chance to look at it.
The Oregon Nurses Association has also pointed out the complicated political and financial relationship between you and the Secretary of State, who oversees the elections, he oversees the referendum process, oversees the gathering of signatures and their validation. You've been, as we mentioned, a paid political consultant for Richardson. Do you see any problem with that, any conflict of interest?
No more than, say, Jennifer Williamson, who's the House Majority Leader, actually gets paid by Future PAC, the caucus arm.
But is that okay, though? Does that make it okay?
Well, everything that I have done, Laurel, is forward-facing in Orstar where people can see it. And, at the end of the day, the legislature, we are part-time lawmakers. And so I don't see a conflict of interest there. I don't think Secretary Richardson sees a conflict of interest there. The nurses union is part of our Oregon, which is the big public employee cabal that brought Measure 97. These taxes, if there is an excess, goes directly to the general fund. It was the only tax revenue that we actually raised. It just helped pay, I believe, for a $100 million raise for SEIU. It's helped pay for things like Cover All Kids, which is the health care for undocumented children. It just helped pay for the $10 million for all of the abortion funding that was in House Bill 3391. This was a slush fund opportunity for the legislature, and they took it. And that is what we find objectionable.
Well, the Oregon Nurses Association also wants Richardson to consider recusing himself in this matter. Do you think he should consider that?
What's there to recuse himself from? The interesting thing to me is if there is a conflict, what is the outcome of that conflict? That voters get to vote? There's no conflict there anyway, but I don't understand what the big conflict is that they are so worried about. If these taxes in this package was so wonderful and Oregonians really do support the Affordable Care Act, which the majority of them do, then they'd vote yes. But the interesting thing is, Laurel, as we've counted signatures, I would say that about 40% of the signatures we've received back are not from Republicans. So these are Democrats, Independents, Pacific Green Party, Working Families Party, people across the state. Their hair is on fire. My phone rings all hours of the night with people wanting to know where to sign the petition and how to sign the petition because they're so frustrated at the cost of health care. And, big corporations, unions like the Nurses Association union, and the insurance companies themselves, they're excluded from these taxes because they're all self-insured.
Well, you're pretty confident it's going to make it to the ballot in January.
We're working on it. It's a night and day, 24 hours at my house process, but I feel like we're getting there.
Just less than a minute left, but I did want to ask you about the governor and the political future, what the Republican Party will do. GOP Representative Newt Buehler has announced that he will run against Kate Brown. She hasn't officially announced, but all expectations are she'll run again. What Republican do you think has the best chance of beating her?
Well, I'm going to support Newt Buehler. And we know the governor's running because she hasn't spent more than 5 minutes actually watching the legislature. She spent her entire time fundraising since the very first minute of the the legislative session. She spent the whole session fundraising while we were in trying to pass laws. So we know she's going to run. That's a given. But I am going to support Newt Buehler. I think he's got a good shot.
A lot of people think you have your eyes on higher office. What would be your dream job?
I don't have a dream job and I don't have my eyes on higher office right now. I am very comfortable just serving the people of my district. There's still a lot of policy bills. I'm sort of a policy wonk. There are a lot of policy bills around education, healthcare, human services, veterans, properly making sure that we implement Measure 96. All of those things are still on my bucket list as a legislator, so I'm fine where I'm at right now.
Representative Julie Parrish, thank you for joining us here on Straight Talk. We hope you'll come back when we have more time to talk about some other things.
Thanks for having me. I appreciate it.
And coming up next, Multnomah County Commissioner Loretta Smith joins us. We're back in 2 minutes.